Tell me a little bit about what's going on.
Well, the reason I use crutches is I've had spinal stenosis for many years.
Yeah, I want everybody to hear what you're saying.
Okay. And for those who don't know, spinal stenosis is where the a bone presses on the major nerve that controls, in my case, the left leg, and it begins to literally strangle that nerve and damage it, and it's constant pain. And as frequently happens to a lot of people in the medical community, I was not diagnosed and then misdiagnosed and treated for other things.
Okay.
And, yeah. So by the time they did the surgery, which was a year and a week ago, I had had the problem for a long time. And so they removed the bone that is choking that nerve, but the nerve is badly damaged. And I use the crutches. Basically, I can walk without them. But if I walk without them for more than about 2 minutes, I'm in an awful lot of pain because I use the crutches to keep the pressure off of that nerve.
Okay.
But I probably had the problem for 30 years, you know.
So what have you tried to make it better besides doing the surgeries?
Everything except powdered bat wings on the night of a full moon.
That's called voodoo.
And I'm about to try that.
Okay, so we'll see what happens.
Physical therapy.
Uh-huh.
I've had a couple of epidurals.
Okay.
I've tried the lidoderm patches, which are prescription.
Okay.
They didn't help at all.
Okay.
And
That's a dermal patch, meaning things going into the body. What we're gonna show tonight is non-transdermal. So.
and you know, painkillers, which I don't tolerate well.
Okay.
I'm not a good painkiller taker.
Okay.
And ice packs, of course, which I do at home. I'll put, you know, there's a time when you just stop what you're doing, lie down, put ice packs on.
So how has this affected your life?
It's been, really it's affected my husband's life. He has to do all the housework. And thank God I have a good husband who does that. But, you know, a lot of things I'd like to go and do, and I don't do. I don't dance anymore.
Okay.
A lot of things I would enjoy doing that I don't, because you can't do them if you're on crutches, and without them, I have a lot of pain.
Okay.
And I don't like pain. If I liked pain, I would have stayed married the first time.
I wish pain was a friendly thing, but it's not. So, okay, friend, what I want to do is I'm going to put these patches on you, but I want you to turn around and face the wall, and I'm going to be doing them on your back. So you're going to talk into this, so everybody can hear you now. So go ahead and turn around, nice and slow, facing the wall this way.
Okay.
Hold that, and you're going to be speaking into that now, just so
Okay.
everybody knows what's going on. So what I'm going to do is, can you point to where the discomfort is? Is it on the right or the left?
Okay, it's on the left,
Okay,
and it begins about here.
okay,
And then it goes into my hip,
okay.
then it goes down my thigh, and into my shin. And, you know, if I really push it, then it'll go into my foot.
Okay.
Yeah.
So then, if you could rate this pain to like a scale, 10 being the worst, 1 being feeling pretty good, what would you rate this pain?
Oh, on a general level?
Yes.
Usually probably runs about an 8,
Okay.
9.
And that's with surgery, with painkillers?
Yeah.
So this is always a mystery to me. I never know what's going to happen. And so we're just going to stick these on. I'm going to stick the white one on here. Now this is how they instruct in the brochure. They actually show you sticking the brown patch on first. But what we've learned is when you stick the white patch on first, that's for like a chronic issue. And this has been going on for a while. So what I'm going to do is stick this one right above it, as the brochure describes, and just see what happens. Is there any difference? It works really quickly, so.
Does it?
Yeah, let's just.
Even on the clothing?
Right through the clothes.
Isn't that interesting?
Once 3 to 6 inches off the clothes. So you said it was about an 8. Does it still feel the same, or has it changed at all?
It's still the same right now.
Okay, that's okay. So that tells me something. So then what I'm going to do is just move it to the next position according to the brochure. And how's that feel?
Still about the same.
Okay. I'm going to move it down now. Now you said this is where that discomfort is, right about here.
That's probably where it begins.
Okay.
This is where the damaged nerve is in my
Okay.
neck. Yeah.
Okay. How's that feeling right now?
It's still about the same.
Okay.
Mhm.
So when you say about the same, it's not changed at all, still at an 8?
Yeah, I
Okay.
would say.
So here's my backup, the glutathione patch. I'm going to have you hold this in your right hand
Okay.
and then squeeze that down. Just hold it there. Now go ahead and talk to the
Okay.
microphone. Has anything changed now?
Um,
Can you tell any difference?
yes, I can.
Okay.
Mhm.
This is information.
Yeah.
And before I go any further, so everybody understands why the glutathione patch, when people come in and they're chemically toxic, we're all exposed to chemical toxicity. This whole room is full of chemicals. Our environment is full of them. And then when we pollute our bodies with medications, as you saw in the video, it starts to make our body not heal the way it's supposed to. So it slows healing down, our natural innate abilities. So what the glutathione patch is doing right away is signaling the body to start dumping chemicals immediately. Okay, so then the body's now saying, ooh, I can go in and heal what's going on here. So you said it was an 8. Is it still an 8? What did it
I'd
go?
say it's probably about down to a 5 now. Mhm.
Now that's powerful. Glutathione. Okay, so then since we're having some results now with this, I'm just going to move this one a little bit down and kind of follow where that nerve root goes. So what does it feel like now? Is it still a 5?
Mm,
Can you
probably,
tell?
I'd say more like a 4.
Okay, so we cut it in half, and we've
Mhm.
only been doing this for about 30 seconds. She's been looking at this for about 30 years. So you said over in your side hip you get some really weird discomfort. So
Mhm.
can you point to where that is a
Where
little
the
bit?
pain really,
Yeah.
right about here.
Okay, because what I want to do is just go ahead and stick this brown patch right on that, and then see what kind of changes we get through this whole area. How does that feel?
Actually, that does feel better.
Okay, like
Mhm.
what number? Because that helps me feel good.
Probably more like a 3.
Okay,
Mhm.
8 to a 3.
Mhm.
We're talking pretty amazing stuff. And again, I never know what's going to happen. So the patches are doing this, not me, and it's working right through the clothes.
Mhm.
Okay, so you know what we could do is we could probably continue to move around and do this for a while and maybe get it even lower. But Fran, could you live with a 3 now?
Better than I was, yeah. It's an improvement, yes,
Yes.
definitely, yeah.
So I would say that is a
Like
successful patching
Yeah.
demonstration.
It's
So everybody kind of
better.
sees how fast it does it.
I guess you just leave them on there or something.
What you do is when you find the best spots, then you take them off like the Band-Aid, and you stick them on and leave them on for about 24 hours. The brochure will say about 12 to 14, but we have found that they actually will work maybe a little longer. But if the body's drawing more from them, they may work less. It just depends on what your body needs, because the body's smart and the patch is just giving it more light and information. So the body will now go in and start removing metabolic debris, breaking open these pain patterns, and allowing the body to clean up an area that's blocked. And this is why the body's not healing and she's having the problem she's having. So,
So does it work better if you put it on the skin?
yeah, then now we would stick it on the skin.
Mhm.
It doesn't work any better on the skin, no.
It
works.
doesn't?
You could leave them on your clothes for the next 24 hours and do
Really?
just the same. Yep.
Oh,
Yep.
very interesting. Does it get better with time, or?
I would say it does. I've had most people, I haven't had anybody say it hasn't. So what you do is you put them on and then you continue to put them on in those areas. Now say it's no longer in that area, but now she feels it's somewhere else. That means we've uncovered a layer of an issue, and now there's the new layer of an issue that we need to go address next, and that may be in that other area. So then it's moving the patch around, it's being really patient with yourself or your spouse that's helping you, because sometimes you need some help to do your own back. And so you just kind of move it around and you find your best spot, lowest pain denominator, and then you stick them on. It's really smart to use that numbering, because if somebody says, I feel a little better, I feel a little better, and you're not really finding the right spot, that information really helps you direct the best placement for the patch.
And the patch itself isn't sticky, but you tape it on.
No, that is actually, the back side of that
Oh,
now
is it? Oh.
is like tape.
Oh, I see.
Yes,
Okay.
yes. So,
And
Pretty cool.
where would she put the glutathione patch?
in the brochure for the glutathione, there are several placements. I would just go to the brochure and stick it on
Together with her
pain patches, absolutely. So what I want to do, Fran, is just demonstrate on someone else. If you don't
Okay.
mind, I'm going to go ahead and take these patches
Okay.
back, and then I will thank you so much for
Oh,
coming
my
up here.
pleasure.
Let me grab these off you. real quick.
Detach me here.
Detach, that's right.